Grooming refers to the practice of nursing babies with their mothers rather than keeping them in a separate nursery. Its advantages are: it promotes bonding, makes exclusive breastfeeding easy, is an early exposure of the baby to maternal bacterial flora. It reduces the risk of nosocomial infections. Parents must keep a close watch on her infant. She should be encouraged to report any concerns that she has to the healthcare staff. It helps with the infant's emotional growth, like falling in love unconditionally, and infant growth and development. Kangaroo care has shown benefits in all infants, from the preterm to the postterm, including temperature regulation, breathing regulation, weight gain, stronger attachment to parents, greater breastfeeding opportunities, decreased crying, longer periods of alertness, and longer periods of sleep. Sleeping basics. As a new parent, you may be surprised to learn that your newborn, who seems to need you every minute of the day, actually sleeps about 16 hours or more. Newborns typically sleep for periods of 3 to 4 hours. Don't expect yours to sleep through the night. The digestive system of babies is so small that they need nourishment every few hours and should be awakened if they haven't been fed for 5 hours, or more frequently if your doctor is concerned about weight gain. First aid for burns. Make sure the area is safe, and that there is no further risk of injury. Take the child to a safe place if possible and take off the child's clothing immediately, but only if it is not stuck to the skin. Treat the burn with cold tap water only. Cool the burnt area under running cold tap water for a minimum of 10 minutes to reduce tissue damage and pain. Hold the child to provide comfort. Cover the burn with a loose, light, non-sticky dressing such as aluminum foil, plastic wrap, or a clean, wet cloth. Raise burnt limbs. If you are not sure how severe the burn is, contact a doctor, hospital, or medical center immediately. Call an ambulance if the burn is to the face, airway, hands, or genitals, or if the burn is larger than the size of the child's hand. Go to a doctor, hospital, or medical center if the burn is deep, even if the child doesn't feel any pain. If the burn looks raw, angry, or blistered, or if the pain persists or is severe, or if you're not sure how bad the burn is. Things not to do with burns are: do not peel off any clothing that is stuck to the burn. Do not break any blisters. Do not apply ice, iced water, lotions, moisturizers, oil, ointments, creams, or powders to the burn. These will only need to be removed to treat the burn properly. If the burn is large, don't cool it for longer than 20 minutes, as hypothermia can result quickly in children. SID, the third leading cause of death. Recommendations for preventing SIDS include placing your baby on a firm, tight-fitting mattress, and remove all comforters and other bulky bedding. Do not let your baby become too hot. Don't overdress. Keep your baby in a smoke-free environment, and don't smoke during pregnancy. Do not lay your baby on pillows, beanbags, or sheepskin mattresses. Breastfeed your baby. While breastfeeding has not been shown to decrease the incidence of SIDS directly, it does decrease the incidence of some upper respiratory infections, which may influence the development of SIDS. Have your baby's caretakers attend an infant CPR class. Your baby's checkup schedule. Birth: 2 weeks, 6 weeks, 10 weeks, 14 weeks, 6 months, 9 months, 12 months, 18 months to 8 years, every 6 months, and 9 to 18 years, every year. FAQs. What can I do to prevent SIDS? Doctors urge parents to always put their baby to sleep on their backs in an empty crib, as there is no guaranteed way to prevent SIDS. However, some steps can be taken to prevent SIDS, including breastfeeding your baby exclusively for at least 6 months, placing them on their back to sleep, and keeping their crib as empty as possible. My baby is running a fever. When should I call the doctor? You should call your doctor if the fever doesn't go down with the use of acetaminophen or ibuprofen, if the fever is greater than 100 degrees for more than 48 hours, if the baby becomes lethargic, is not having wet or dirty diapers, or is not eating or drinking. Ibuprofen should only be used if the baby is 6 months of age or older. How should I treat a baby yeast infection? A yeast infection can occur in the mouth, called thrush, or on the butt, which is called Candida diaper dermatitis. There are oral drops for thrush and a cream for the bum. But be careful not to confuse the wrong medicine for the wrong area.